How will mandatory privacy breach reporting affect you? In May of 2018, the province of Alberta proclaimed mandatory privacy breach reporting amendments to the Health Information Act, or the HIA. Custodians will be required to report privacy breaches with risk of harm to the Office of the Information and Privacy Commissioner, or the OIPC, and the Minister of Health. Now, currently, privacy breach notification is voluntary. This new mandatory privacy breach reporting will impact all custodians, including physicians, chiropractors, dentists, dental hygienists, podiatrists, midwives, optometrists, opticians, registered nurses, pharmacists, and more. So today we're going to talk about how we're going to manage a privacy breach. My name is Jean Eaton, and I am your practical privacy coach and practice management mentor with Information Managers. My role is to help healthcare providers, owners, and privacy officers to prevent a privacy breach and to be able to manage it appropriately. So in Alberta, we need to ensure that we are prepared for the new mandatory privacy breach reporting that takes effect on August 31st, 2018. I am Jean Eaton, your practical privacy coach and practice management mentor with Information Managers. I'm also the host of this Practice Management Nuggets, webinars for your healthcare practice, and the podcast. My work background has covered over 20 years in healthcare in Alberta. I've been a manager of health records departments in hospitals across Canada, and I am a coach and an expert in making practical recommendations for thousands of independent healthcare providers that comply with privacy legislation. I'm a consultant and a speaker on the topic of privacy breach management, including the Virtual Privacy Officer on Demand. As a privacy awareness training facilitator, I've had the honor to share my obsession about practical privacy and confidentiality with hundreds of medical clinics, healthcare practices, and organizations across Canada and the U.S. With over 20 years of experience in health information management and healthcare administration, I'm here to help independent practices, healthcare providers, and practice managers to improve the privacy breach management programs in your practices. I believe that practical privacy breach management is a reasonable safeguard to protect patient information and the reputation of healthcare providers and the clinic. So today, in this 30-minute webinar, we will talk about what is a privacy breach, why a privacy breach is a significant problem, why have mandatory privacy breach reporting at all, and offense and penalty provisions of the Health Information Act, and what you need to do before August 31st. Now, I want to remind you that you can ask your questions at any time in the chat box during the live webinar. And if you're listening to the replay or the Practice Management Nuggets podcast on Stitcher or iTunes, you can reach me on social media or email me at jean@informationmanagers.ca to ask me a question. Remember to follow the link in the show notes. So let's get started with a few definitions, followed by some privacy breach examples and your next steps that you need to know to implement a privacy breach management program in your healthcare practice. Now, a privacy breach affects many people. It affects both the patient and the family that the information is about. It affects the healthcare provider and the employees in an organization. And it will affect the business of the healthcare practice. Now, privacy breaches happen all the time. Did you know that 80% of all privacy breaches occur internal to the organization? So most of these breaches are oopses or an honest mistake or a result of not carefully following procedures. Sometimes there is a pattern of similar breaches that indicate a broken workflow or automated process or careless or disregard to the security of personal information. Every time that you have a privacy breach in your practice, you must manage that breach and prevent it from happening again. Every time that you are fighting a privacy breach fire, you're not providing continuing care and treatment for your patients. So managing that privacy breach in the most efficient way possible is going to save you time and money. Now, did you know that the personal information is a commodity that is traded on the dark web, in your local strip mall, and in the high schools? There is an active market for personal identities with great financial incentive to steal or misuse that personal information. In fact, healthcare data is more valuable than financial information. Healthcare providers are a high-value target because of the long-term value of health information. Now, once somebody has access to personal health information, they can use it to make a fraudulent insurance claim, access to service, and leverage the information for other purposes related to identity theft. And it creates a huge risk to the real patient with the inaccurate information is being added to the owner's healthcare records, which can cause errors or delays in receiving necessary care and treatment. So sometimes the information is intentionally stolen to harm a specific person or for financial gain. Sometimes the theft is by employees and sometimes by visitors to the business. Sometimes the theft occurs from outside of the business, for example, about hackers or contracted service providers or business agents that have access to your information. So we're going to talk about the costs to the healthcare business further in a few minutes. But right now, what we're going to do is take a look at a few definitions and some examples. So a privacy breach is a loss of personally identifying information. It can be included as an unauthorized access to that information, unauthorized use, unauthorized disclosure, authorized access to unauthorized use, include personally identifying information or information that could be personally identifying. So a privacy breach has many different ways that it could come about. So personal information can include a lot of different things. It can include your name and username and password, your age, your date of birth, an ID number. Your email address and an IP address is also considered as personal identifying information. Of course, your home address, postal code, and a variety of other information. In fact, any information that identifies a person or can be linked with personal information is considered personal information. Now, that also includes biometric information. So as we get different technology in our practices, we may actually be using biometrics, for example, a fingerprint scan or an eye scan or a picture of your face to open up an application on your iPhone. Combining non-identifiable pieces of information that can uniquely identify an individual makes that information personal information. Now, health information is a little bit different. Under the Health Information Act, it includes anything that is of two types of information: diagnostic, treatment, and care information, and registration information. Now, it also includes the registration information or the demographic information of the patient, but it also includes the registration information of the healthcare provider. So, for example, if the billing information includes the healthcare provider's PrAC ID information, then we also include that as a privacy breach that includes health information. It's really important that you understand what is health information or personal health information, because when you have a privacy breach, you're going to have to backward chain it and figure out if the information that was released or somebody who has access to it inappropriately has access to information that would be considered personal health information under the Health Information Act or in other legislation. So you might have a privacy breach that includes your employees' information. For example, you were sending your payroll information to the tax accountant to do up the T4 slips for your employees. It doesn't include health information, but it's personally identifying information to your employees, and you still need to manage that privacy breach. So privacy breaches include personal information, and it may include health information. Privacy is your right to decide what information that you want to share with somebody else. Who is it going to be shared with? When is it going to be shared? How am I going to have access to that information, and how you're going to protect that information? Now, when patients come to your clinic, they expect that their information is going to maintain and be private. So your patients expect that you're going to do this with their information. And your patients should be asking you questions about How are you going to manage my information? But patients don't always ask those questions. We need to anticipate those questions and tell them in advance about what are we going to do to protect the privacy of their information. And that's why we have the posters in the clinics to say, we promise to collect only the least amount of information that we need to provide that health service and to keep that information safe and secure and to follow the rules of the Health Information Act. Now, when I talk about the elephant in the room, it's that thing that we all know is there, and we sometimes try to forget about it. It doesn't take a lot of information to make something personally identifying. So if you're taking a look about what's included in a privacy breach, if it has any 3 pieces of information that put together would uniquely identify a person, then it's a privacy breach and it's personally identifying information. So even that email address or that IP address, the things that we think are perhaps not included as a privacy breach because it's just the scheduling information, it's just an appointment reminder, well, you need to take another look at that, because if that goes to the wrong place, that could be considered a privacy breach. So we need to be careful about what information is included in a privacy breach, and even understanding that just your name, your date of birth, and a postal code is considered personally identifying. And if it's lost or stolen or used in an unauthorized way, that it is a breach. So we need to respect our clients, customers, and our employees' information. So why is a privacy breach significant? Well, privacy is important to us. We think it's important that our personal information is about ourselves, and we can decide how we want to use that information. If our information about ourselves is shared in a way that we didn't anticipate, then it becomes important to the individual that the information is about, and we always need to remember that. A privacy breach is significant for your healthcare practice because it's expensive. There are direct costs that you need to incur if you have a privacy breach in your organization. And in fact, I'm going to say when you have a privacy breach. There's been a lot of statistics that have been aggregated about privacy breaches, and we can say with confidence that every healthcare organization is going to have a significant privacy breach within the next 5 years. So if you haven't already been a victim of a privacy breach, I can almost guarantee you that within the next 5 years, you are going to have a significant privacy breach in your organization, and you're going to have to be prepared and be ready to act so that you can manage and mitigate these risks. There are many direct costs about a privacy breach, and there are a number of indirect costs. Every time that you need to notify a patient about a privacy breach, on average, it's going to cost you about $250. So if you have a privacy breach for one patient, you can expect that you're going to have a direct cost of at least $250 to notify that patient. But we don't always have privacy breaches just on one patient. Oftentimes, it's a broken process or a bigger problem, so you can compound that by the number of patients that you have to notify in that privacy breach. So if you've got 10 people that you need to notify, that's $2,500. If you've got 100 people, it gets exponentially more and more. Of course, you have all of those indirect costs as well. So a healthcare business can spend between $150 to $2,000 or more for each individual that requires that notification, including both the direct and the indirect costs. Now, that's an average number, but it makes for some easy math to do when you're talking about return on investment, about managing and preparing for that privacy breach. I like to think that privacy is really important, and it's actually a gift of privacy is a sign of respect for your patients. Now, a privacy breach affects all types of healthcare businesses. The healthcare system is a highly integrated information sharing system designed to provide timely and accurate care and treatment to patients and to receive financial compensation for those services. So when a privacy breach affects one healthcare practice, there are many downstream implications to other businesses. When one business has a privacy or security breach, there is a risk that the public, including our patients and our clients, may think that all healthcare businesses, including yours, have the same problems. So we want to make sure that we are responding to those privacy breaches with transparency, timeliness, and that we are doing it in a way that makes sense to the public. Now, when we talk about a privacy breach, one of the things that we need to consider is what is the risk to the individual when that information is provided to people with unauthorized access to that information. What type of harm could happen to that patient? Now, in many legislation, we talk about the reasonable risk of significant harm. It's also called ROSH. Now, under the Health Information Act with the new regulations, they talk about a reasonable risk of harm, which is a RO, which is a little harder to explain. So I'm just going to go ahead and use the terminology ROSH because it sounds a little bit easier. Just know that the terminology in the Alberta legislation is ROH, a risk of harm. But it means very much the same thing. So the risk is pretty big to an individual when their information is disclosed without their consent or without their authorization. Now, it could be a number of different types of things. It could be a patient is a victim of water cooler gossip. People know things about them that they didn't want to share. And that can be a really significant harm for an individual. Of course, there are other types of harms as well. The patient may be at risk to blackmail or stalking or actual violence because of the information that's been released about them. Now, the other way to think about this is that as an employee in your healthcare practice, we have access to a huge amount of information, and there is a huge value to that information. When people trade this information on the dark web, they're getting upwards of $150 to $250 per personally identifying information. Unfortunately, we have experience where we have employees in healthcare practices that they themselves are being victims of blackmail and abuse because somebody else is telling them that they have to go to work and get this information and bring it back to their spouse or their blackmailer so that they can take financial advantage of that information. So not only could this be an effect for the patient, but your employees are also potential victims of risk because of identity theft and because of privacy and security theft of this high-value target information that we have in our healthcare practices. So we need to think about the information in our practices in a different way so that we can prevent this. Now, of course, one of the prevalent sources of risk or ROSH is identity theft. And we have access to a lot of information. And if that information gets put in the wrong hands, then bad things can happen about assuming the information about that patient that is of detriment to both the patient and, of course, the custodian that should have been looking after that information. There are penalties under the Health Information Act when there are fines, when there are privacy breaches. Now, the Health Information Act has established fines for anyone who knowingly collects, uses, or discloses health information and who gains or attempts to gain access to that information in contravention of the Act. So individuals who breach privacy and access rules could be subject to criminal charges and fines of up to $100,000 under the Health Information Act, and of course disciplinary measures within their licensing or professional organizations. So this are for employees that knowingly take access to the information and do something that they're not supposed to with that information. Now, if you make a mistake or an error in judgment or an oops, you need to let your supervisor and your privacy officer know about that. So nobody wants to tell the patient that a mistake has happened, but most of the time the patient appreciates when you've contacted them to tell them about that mistake. We are human and we will make mistakes, but mistakes are also a good opportunity to review our practices and prevent and learn from that and prevent those mistakes from happening again. If you make a mistake, you are not likely going to go to jail. If you intentionally steal information from the healthcare practice, there are fines, you will get caught, and you might go to jail. We need to remember that every time that we do have a privacy breach, that the information is important to the individual. So it may be only one person. It may be just their scheduling information. It might be, well, maybe it's just the prescription information. But to the person who owns that information, it becomes really important to them. So if you deal with hundreds of faxes in a day, or you see hundreds of patient information in a day, and there's one little thing that leaks, maybe it's not such a big deal. We have to remember that it's a big deal to that patient. The biggest mistake in managing a privacy breach is ignoring the privacy breach. This is the number one mistake. The first step in managing a privacy breach is to recognize a privacy breach and then containing that privacy breach. And the new regulations include penalties for custodians and affiliates who fail to report a breach. So not only is it important that we recognize the breach, we must also report it. Now, when we talk about reporting a breach, you need to report it to your custodians. That's your physicians, your pharmacists, the dentists, the chiropractors that you work with, and you may also need to report it to other folks. But the biggest step is to remember is to identify that privacy breach, and then we can take steps to manage that privacy breach. So I want to share with you a couple of examples about privacy breaches and what the new differences will be under the mandatory breach reporting laws. So here's an example about a malicious privacy breach in contravention of the Health Information Act and the Criminal Code of Canada. In 2014, a medical lab assistant at Calgary Lab Services was found guilty of knowingly accessing the personal health information of 34 people in contravention of the Health Information Act and for falsifying documents. So what happened here is that the assistant who was working for the lab had altered lab test results and unlawfully accessed health information of 34 people, including neighbors, acquaintances, and family members, and people that she had an interpersonal conflict with. She pled guilty to one global charge of improper access under the Health Information Act and 3 charges of uttering forged documents under the Criminal Code of Canada. Now, in this circumstance, the individual had a 4-month conditional sentence and 8 months probation. So that means that if she didn't follow the rules of her probation, then she could be going to jail and spending time in the cells. She also received a $500 fine under the Health Information Act. Now, some people would suggest that a $500 fine for a privacy breach of this kind is not enough. And we'll see in a few more examples that there are a variety of fines that could have been applied. In this case, she could have been fined up to $50,000 for each of those breaches. But the judge in this case decided that the criminal charge had a great deal of impact, so that the monetary fine was not going to be as big as it could have been. So is this a privacy breach? You bet. And we can see that the Health Information Act does have penalties associated with it, but also that it's really important that the information became public. We want to make sure that our patients and our public know that privacy breaches do happen. People do bad things. And in this organization, they caught it, they reported it, they followed up and made sure that it didn't happen again. And that's one of those things we want to be able to share with people when a privacy breach happens. So I would like you to warm up your keyboards and enter in the chat about whether or not you think this example is a privacy breach. So in this example, this lovely lady received a letter in the mail, and it included the test results about Amber. And Amber apparently is pregnant. So if a patient receives a letter in the mail about another patient, do you think that's a privacy breach? Enter it into the chat. Yeah, absolutely. This is a privacy breach. So this happens on a regular basis. We talk a lot about technology in our EMRs, but a lot of the basic information about how we manage paper still continues to be a #1 source of privacy breaches in our practices. Now, let me ask you another question. If you sent a fax from one place and sent it to another place and it was the wrong place, is that a privacy breach? So if you send a fax to the wrong place, is that a privacy breach? Yes, it is, because it wasn't to the person that was intended to receive it. What if you're working in the clinic and the patient's told to go to the front desk to get a copy of their test results or their requisition forms to go and get the lab results? Or somebody hands them the prescription that's been printed off of the computer printer, and they walk out the door and they go to the pharmacy to get it filled and find out it's for the wrong person. Those are privacy breaches too. So each of those examples are privacy breaches that we need to have a system in place to make sure that we're managing them and preventing them from happening again. Now, another common example is our garbages. In this situation, imagine this. A bystander reported to the news media that they had found patient medical records in the dumpster by a health center. Then they contacted the news media to tell them about it. The healthcare center heard about it the first time in the news. And in fact, so did the patients. The investigative reporter received a tip from the bystander, and then they found one of the patients and showed her the information that they had found in the alley. Now, would you like your patients to find out about a privacy breach by having an investigative news reporter coming to their house and showing them the personal health information? Obviously not. And we want to make sure that it's easy for people to do the right thing. That's why we have the posters in our clinic to say, this is what we want to do to protect your information. This is why we've got the footers on the bottom of your fax forms to say, if you receive this in error, give us a call. It's not that it's going to make it any better. It's going to make it easier for the Good Samaritan who receives that information to do the right thing and call you so that you can follow up on that privacy breach practice in a way that you would want to tell your patients and your customers and the public. Now, we have a number of situations like this that the information gets public before we have the opportunity to learn about it. So one of the things that you need to know in your privacy breach management program is your communication strategy. This is likely going to happen to you at some point. And unfortunately, we've got lots of examples that we can call on to help you prepare now. If this happened to your clinic today, if you got a call from CBC Newsroom to say that they found a bunch of your patient information in the garbage, how would you respond? This is your opportunity to create that press release, that media communications, and let them know how you would respond to that sort of a situation. So you can draft out these press releases now, think about these bad situations, and prepare for it now so that you get that phone call, you know what to do next. Now, I want to share another example with you about a privacy breach. And in this situation, a physician was working in the emergency room at a hospital, and there were many other people working in the emergency room with them. Now, when the physician waited for a colleague to leave their workstation, and that person had not logged out of the workstation, had not logged off of Netcare, then the physician sat down at somebody else's computer and then looked up information about their family and use that access to be able to snoop on their ex-spouse and their family. What do you think? Is this a privacy breach? A physician has access to Netcare, but they're looking up their information about their spouse on Netcare. Yeah, it's a privacy breach. Even though you have authorized access to Netcare, you are not authorized to look up yourself, your family members, or your friends. So the authorized access to Netcare is only to provide that health service. That's part of the job that you do. If you want information from Netcare about yourself or your family, then there's a process to do that, and it's not using your Netcare access to do that you would use to do your job. So in this case, it did actually happen. It's a for real example, and there was an investigation. So the victims or the other family members realized that people knew things about them that they did not tell. So they made a complaint to the commissioner's office. The commissioner's office did an investigation, and eventually in the investigation, they did find that there were poor practices in the healthcare organization. So the organization was held accountable in the investigation that they had inconsistent training and sanctions, so that the people that left their workstations open, they were the ones that were disciplined first. So they got written letters of reprimand to say that they had poor practices in place. And sometime later, the physician who looked up the information on Netcare eventually fessed up that they were the ones that looked up the information. So the people that left their Netcare account open, they were given letters of warning. The organization was given a warning from the commissioner's office to say, you need to improve your privacy training programs. You need to make sure that everybody attends privacy awareness training and that there is documentation that they attended. So this included your professional staff, including your physicians, need to make sure that they've attended that privacy awareness training. So the organization did report and follow up with the commissioner's office about the practices that they've improved this with. One other quick example about a pharmacist who was fined for posting patient information on social media. Now, this happened in 2014. A new pharmacy grad was hired at a pharmacy, retail pharmacy in Edmonton, and that retail pharmacist did all the right things. He did the hiring review, they did the reference check, made sure that they had passed their college boards exams and were professionally accredited. They had privacy impact assessment, they had privacy awareness training, and in fact had privacy awareness training on Netcare for this particular new physician coming to that practice. But there was an interpersonal conflict, and for some reason, this new pharmacist went on to Netcare, got information about these people that she had an interpersonal conflict with, and posted it on her Facebook account. Don't do that. This is a bad thing. Do not post patient information on Facebook, just to be really clear. Now, what ended up happening in this investigation is that the people that were outed on Facebook reported it as a privacy breach to the commissioner's office. They did an investigation and they worked with the pharmacy owner to identify what happened and who was responsible for it. In this case, the pharmacy owner could demonstrate that the pharmacist should have known better. They had the training in place and she still did this and posted it on Facebook. So the pharmacy owner still had to go through the investigation. They still had to go through the privacy breach reporting process and reported it to the patient and to the college at that time under those laws. But it was a malicious breach for that pharmacist. And that pharmacist was fined $15,000 under the Health Information Act and was disciplined by her regulatory college and suspended from privileges to work in Alberta for a year. One other really quick example is a situation of fraud in the organization. Now, this is a visitor who came to a clinic and took information about patients from paper from the clinic and, grabbed it and put it in their bag. And when they left the clinic, used that information to leverage and get access to credit to be able to buy furniture under the patient's name. Now, the patient in this case noticed that there were some unusual transactions in her financial records and was able to report that information, and there was a subsequent investigation about that. So these examples have been when patients have noticed that there's been a privacy breach and they've reported it and the investigation happened. Now, what if you find out that your system has been hacked? So in ransomware or cyber extortion, you'll get a message to say that your computers have been hacked and you don't have access to your information. Now, the loss of information, you've lost control of that information, that is a privacy breach. So in this case, it wasn't that the information was taken away, it was that you couldn't access it. Now, if you have good backups in your system, you will be able to restore the information on another system, so you're helping to mitigate that risk. But somebody else, you still need to report that as a privacy breach because you've lost that control. Now, initially, we found that there were a number of ransomware attacks, that the information was encrypted so that people couldn't access it who were supposed to, but they didn't do anything with that information. We've got some recent examples in Ontario where ransomware was taking place, where they encrypted the information so that the physicians couldn't access it. But then the bad guys took that information and were sharing the information, in this case actually with CBC News investigative reporters, to demonstrate that they had all this information. So there are lots of different ways that there could be a privacy breach. Another common way is when we have information that is unencrypted. So if you have USB sticks, if you have laptops, make sure that that information is encrypted. And because it's encrypted, then it's less likely to be considered a privacy breach. We have lots of examples about privacy breaches on unencrypted devices, and this is an important one to understand. In 2011, there was a significant privacy breach where a clinic shared information with an IT vendor. So the IT vendor was helping to do some troubleshooting. Now, the IT vendor had the laptop that had the information on it, and that laptop was stolen. Now, the information was stolen and it wasn't encrypted. Now, there was a significant problem with this, and I want to explain it to you because it is the impetus for the new mandatory privacy breach reporting. The laptop contained information of over 621,000 Albertans. Now, in the investigation, what ended up happening is that the commissioner's office became aware of the privacy breach. It was not reported to them, but they became aware of that information, and they implemented an investigation because there were so many individuals that were affected by this breach. And we find in the investigation that the clinic was the information manager on behalf of all of the participating physicians. There were multiple sites. Now, the clinic management team was the information manager, and they managed the privacy breach, which is okay. But what they did not do is contact the custodians or the physicians to tell them about the privacy breach. So the clinic was managing the privacy breach, but they had not told the physicians, and that's a violation under the Health Information Act. Now, in this case, the clinic did not provide instructions to the IT vendor to tell them how to protect the information, keep it safe, and make sure that everything was encrypted. Now, you might think that if you're a clinic manager that you don't need to tell the IT department to encrypt the information, but you need to. You need to have it in writing, and you need to be able to demonstrate that you've done this, because you cannot make the assumption that the IT vendor or the healthcare professional knows and understands what is a privacy breach and what are reasonable safeguards. The other thing that happened out of this investigation is that the breach information was made public in Alberta, and there was a lot of discussion and a lot of concern expressed about so many patients' information being made available. So this became the kickstart for mandatory privacy breach reporting to both the Commissioner's Office and the Minister of Health. So the amendment was proclaimed, and now we have to deal with that the reporting for mandatory privacy breach reporting. So the custodians must report a privacy breach if there is a risk of harm to the individuals, and the affiliates must report a privacy breach to their custodians. Mandatory privacy breach reporting to the regulators, to the OIPC and the Minister of Health, will help to ensure that the breach response and notification is comprehensive. A central oversight with the OIPC and the Minister of Health will provide the opportunity to anticipate any additional risks of privacy and security within that broader healthcare system in Alberta. The importance of securing the health information and to appear to appropriately respond to that privacy breach is one of those desired outcomes of the new mandatory privacy breach reporting. So the new notification requirements require a privacy breach report to the Commissioner's Office and the Minister of Health and the individuals affected by the breach. Now, there may be other people that you need to notify, and that hasn't changed. So you might need to report it to the police, your insurance company, the CMPA, and a variety of other folks. So that will be dependent on the nature and the type of the breach and the circumstances. But the new regulations require privacy breach reporting to the Commissioner's Office and the Minister of Health. Now, the interesting piece with this is that the regulations have not yet been made available from Alberta Health. So we don't know exactly what are going to be the triggers for privacy breach reporting and how you are going to report that privacy breach. However, we do know under the legislation that if you fail to report a breach, and fail to take reasonable steps to maintain the safeguards, that the custodian could be liable for an offense of $50,000 fine. So we know that we have to do privacy breach reporting, and we don't know all the details yet. What triggers a privacy breach notification? Well, we can make some pretty good assumptions now to be able to anticipate and help to prepare for this effect in August. So if there is an intention to steal specific information for financial gain, we can make a pretty good assumption that that needs to be reported to the Commissioner's Office. If there's been a theft by employees or visitors from the business, then we can guess that we need to report that too. If there's been a snooping or malicious access to the information, or that there's been a large number of persons affected by that privacy breach, then we can anticipate that we need to report those privacy breaches to the Commissioner's Office and the Minister of Health. Now, if there is an individual event or a one-off incident, or perhaps an oops or a mistake, then I'm not so sure yet whether or not we need to report those to the Commissioner's Office. But we do need to monitor and manage that within our organization. So those individual events we need to record, and the big ones too. But when we start to record those individual events, we might see that there is a pattern of similar breaches, and those patterns may indicate a broken workflow, an automated process, or carelessness or disregard of security of personal information, and that probably will need to be reported to the privacy officer and the Minister of Health. So while we're not sure yet what those triggers will be, and the Minister of Health will be releasing the regulations that will give us a better idea, what's going to help us the most is the examples that the Commissioner's Office is going to be releasing about what type of information got reported and how it should be managed on a go-forward basis. So you're going to have to stay in tune to what information needs to be reported, and we'll learn from examples from everybody. When we manage a privacy breach in your organization, we need to be transparent, approachable, and consistent. So these are really big pieces that you need to have in your privacy breach management program. We want our custodians and affiliates and our patients to understand that we believe in privacy and confidentiality of health information, and that we will take reasonable steps and safeguards to protect the security of personal information of all kinds. Now, we also understand that errors and honest mistakes happen to all of us. We need to be approachable so that people feel comfortable to bring these situations to our attention as soon as it happens, so that we can spot it, stop it, and manage that breach. And we need to understand that we need to address a privacy breach each and every time that it happens. So every time that there is a privacy breach, expect to fill out a privacy breach form. That's something that you need to do internally, and then you may need to report that to the Commissioner's Office or the Minister of Health. So to help you about creating your privacy breach discipline process, I'd like you to consider about how you're going to administer discipline for privacy breaches. So there needs to be some types of sanctions, and it needs probably to be consistent. It needs to be fair. It needs to be reasonable. And it needs to be enough so that it's a deterrent, so that it doesn't happen again, or somebody else thinks that they can get away with having a privacy breach and no bad thing was going to happen to them. So whether or not it is your front office receptionist, your clinic manager, your physician, or your pharmacist that releases the information in error, we should expect that there will be sanctions about managing that privacy breach, that it will be fair. If I'm working in a clinic and I send out 100 faxes a day, I am probably going to have a privacy breach with faxes. It may not be something that I I may have misdialed that information. I may have sent information to a fax number that was given to me and I dialed it correctly, but it was the wrong fax number. So we need to make sure that people aren't afraid that if they send a fax to the wrong person, then it means that they're going to get fired. It means that they have to fill out a report, we'll work on it together, figure out what happened to prevent it from happening again. So when you talk about building your discipline procedures, I hope that you would consider these privacy breach discipline principles as part of your practice. Now, your privacy breach management program probably is going to contain each of these 5 steps. You need to have a privacy breach management policy. You need to have a response plan. You need to have training in your organization so that people know how to recognize privacy breach. And then so some of those people in your organization know how to implement and respond to a privacy breach. So there's different levels of training for different people depending on their roles in the organization. You need to have a discipline policy. When you get a call from NetCare telling you that they have proof that somebody in your organization are looking up themselves in NetCare, is not the time to figure out what are you going to do next. You need to have that discipline policy in place before you're dealing with those privacy breaches. And that privacy breach can happen tomorrow, so you need to get these policies in place today. You need to have a way to record all of the reported privacy breaches, all of the ones that are reported within your organizations, and all of the ones that you report to somebody else. Now, if you have a privacy breach in your organization and you look at it and you figure out what happened and you say, well, this was a privacy breach, but I don't think it's big enough, bad enough, or important enough to report it to the commissioner's office for whatever reason, you need to make sure that you are recording what those reasons are. So you need to have a defensible situation to say, we noticed it, we did these things, and we chose not to report it for these reasons. So that's also a requirement of the legislation. Now, we talked earlier about the biggest mistake in managing a privacy breach is not recognizing the privacy breach. Well, the second biggest mistake is not knowing what to do about it. So we've talked today about recognizing a privacy breach and being able to identify whether or not there is a risk of harm to that individual and some of the steps that you need to consider so that you can report that privacy breach. Now, if you need some additional help with your privacy breach management program, we do have an online course called the 4-Step Response Plan to Prevent Privacy Breach Pain. So I'd like to introduce this to you. So this is an online education with quick and helpful content so that you will properly manage a privacy breach. And it includes templates for policies and procedures and discussion groups so that you can customize those policies and procedures for your practice. Now, today, while we're on the webinar, I'd like you to let me know about what you've learned in this webinar about privacy breach and your questions about managing a privacy breach. So I'm going to answer your questions in just a couple moments and give you a chance to enter them into the chat button. Now, this course is online. It's called the 4-Step Response Plan, and it's available now and has been for a couple of years. I'm updating the course information about the mandatory privacy breach reporting requirements as they are announced from the Minister of Health. So because they're not announced yet, I haven't got them in the course. But the course does include your policies and procedure templates so that you can develop a privacy breach management program now. And when the mandatory privacy breach reporting rules are available as the regulations, then I'll update the course and you can update your policies and procedures as well. So there are 6 interactive lessons, there are video instructions, and of course there's an online discussion group and access to me so that you can get some feedback to answering the questions that you have in the course. The course is available to you online, and you can work at it at your own pace, and you can go back to it over and over again if you need to go back and tweak things as you're managing privacy breaches in your organization. So to get more information about the course, you can go to the website informationmanagers.ca/4-step. So when we know better, we can do better. And I hope that today that our presentation has helped you to be better prepared to manage a privacy breach in your organization, both today and when the mandatory privacy breach reporting comes into effect in Alberta for August 31st of 2018. So I hope that this has helped you to manage that privacy breach. And I would like to hear from you about what you learned today. So if you can enter in your chat button about what you learned today or one thing of value that you learned today, I would love to hear about that from you. I also want to challenge you to take action. You've spent time with me today, more than I thought we were going to get through today. It took longer than I expected. I apologize, and I thank you for staying with me. So how are you going to take action with this information? How are you going to get the best value out of this organization? So what I would like you to do for yourself is to write down the one thing that you will start doing, stop doing, or keep doing as a result of this action. What are you going to do with the information that you learned today? So I would love to hear from you about what you learned in the course today and how we can help you. Remind you that you can access the course at any time at informationmanagers.ca/4-step. So I've entered that link into the chat button, and if you're listening to us on the replay or on the podcast, you'll find the link on the show notes. So I want to thank you for joining me today. I'm going to stay on the line to answer your questions, and I'm going to just remind you that Practice Management Nuggets is available as a podcast. If you are listening to Practice Management Nuggets podcast on Stitcher or iTunes or now on Radio Public, remember to subscribe to the podcast. When you like and comment on the podcast, it makes it easier for other people who like what you liked to find the podcast. Now, I want to remind you that I search for guest experts who will share their number one tip for you. So let me know if there's a topic or a guest expert that you want to hear on Practice Management Nuggets webinars for your healthcare practice. Until next time, I'm Jean Eaton, your practice management mentor with Information Managers. So I'm going to stay on the line, and if you've got additional questions, if there's something you'd like me to go back and review with you, and I'd also like to give you a bonus. So we've got a course that's online. It takes 15 minutes, and this is something that you can share with your staff. They can go to informationmanagers.ca and /spot privacy breach. And this is a short 15-minute video that talks about spotting a privacy breach and what the next step is. So a spot privacy breach, and you can share this link with your staff, with your students, and there is an interactive quiz, and when they complete the quiz, then they can actually get a certificate of attendance that they can download and share with you to let you know that they've taken action about privacy breach awareness. If you like this episode, please subscribe to this channel and add your honest feedback to the comments below. When you leave your review, it helps people who like what you like to find this podcast. Until next time, this is Jean Eaton, your practice management mentor with Information Managers.